Thank you for joining us for today's webcast, Elective Procedure Readiness and Second Wave Preparedness. We are joined today by two healthcare supply chain experts, John Strong, co-founder of Access Strategy Partners, and Dennis Orthman, former Associate Executive Director for the Strategic Marketplace Initiative. Thank you both for sharing your expertise. John?
So I've been telling people that have been asking that any supply chain professional should probably be forgiven for missing the demand spike for COVID-19, but I think everybody's going to be tested and what's going to happen next, though. And that's really what we want to focus in on today, are the things sort of beyond the spike for COVID-19. So what we'd like to do is help you understand a little bit about the CMS gating criteria first. Essentially, as most folks are aware, on March 18th, the CDC ordered a limit on non-essential care, which has caused a significant financial crisis for many hospitals, since 50 to 80% of hospital revenue typically comes from elective procedures. Today, CMS has put in gating criteria. And Dennis, do you want to talk just a little bit about what that gating criteria is and what it means in terms of the supply chain?
Sure, John. And as folks can see here, there are three phases that are laid out. And I think it's important to remember that there are three things happening in supply chain right now as we enter this new era of the post-coronavirus time period. Folks are still responding to the crisis right now. The pandemic is not over, and the need exists immediately today. Also, as depicted in the CMS phases, there is a need for recovery. We've got to recover financially and operationally from all that's happening, and we also need to realign to a new normal, if you will, within the industry that we expect to see. The first phase that's been outlined by CMS, the gating criteria requires a 14-day decline in COVID rates before you can start elective surgery. In response to the gating criteria, the American College of Surgeons, AHRMM, and the American Hospital Association and others have issued a joint statement recommending that healthcare organizations form a hospital prioritization committee to guide them through these phases. That committee would provide guidance on specialties that get priority, facility changes that are needed, staff and equipment and supplies that are needed, and how to do all of this in a social distancing environment. So it's imperative that supply chain leaders be involved and play a strong role in these prioritization committees. Meanwhile, while planning and implementation for phase one are underway, supply chain needs to rebuild and refortify at least a 30-day supply and establish new relationships to keep those channels open. Phase two of the CMS criteria calls for a second 14-day decline in COVID rates. It's important to point out to people that two 14-day periods of declining rates are needed to get back to full operations. That's going to be a very difficult situation. At the bare minimum, folks would be able to get started in 4 weeks if they're able to hit those two goals. Phase three indicates a new normal. And while no one knows exactly what that is, I think we can expect to see an increase in the use of telemedicine and emphasis on home health care, as these pathways for healthcare delivery have gained support during and after the crisis. And I'll offer one last thought here, John, to keep in mind that these phases of recovery, 1, 2, and the new normal, it'll take place in the warmer months of the year, and you need human resources to do these things, and right now everyone's pretty tired after the last couple of months. So I ask everybody to keep that in mind as we move ahead.
It's true, Dennis, and I think we refer to this as a sort of a tsunami of pent-up demand for elective surgery procedures, and that's illustrated here in the red line. Seema Verma from CMS came out last weekend and said that she's hoping that this is going to be more like a sunrise. But I think the financial situation for many hospitals is going to sort of push them to try to reopen as quickly as possible. And so you have this sort of conflict operating here between the need for additional revenue and the need to do this on a gradual basis. So what does this all mean? Number one, we have to have a 30-day supply of PPE in each facility, and then we need to be able to maintain it. And unfortunately, right now, many healthcare supply chains are still heads down trying to find stable supplies of PPE, much less maintain it. And Dennis, you made the point the other day that this is probably a time when good supplier relations are key to success in understanding the C-suite's view of the gating process. Do you want to talk about that for just a second?
Sure, John. I know from talking with a lot of leaders on the supplier side, but they too are trying to find ways to deal with this and prepare for it. Supplier relationships will play a key role in how you maintain that 30-day supply. Perhaps supplier relationships have been strained in the constant, intensive look for new sources for personal protective equipment. I would emphasize too that distributors need to open up with their customers about allocation methods and the supply chain that feeds their inventory. And security is another piece that's important. You have in here on this slide, John, lock down your supplies. All of this personal protective equipment has become even more valuable than it was before. So make sure you have security over your supplies.
Right. I think that's exactly right, Dennis. And we've given a couple of examples of products that you want to be sure you have sufficient allocation for going forward into the future. As we sort of wrap this up, this whole notion is going to be followed potentially by what some experts feel is a second wave of COVID-19 in the fall, which is going to, of course, put additional strain on healthcare supply chains. Do you want to talk about that, Dennis?
Well, yeah, this second wave in the fall is going to, again, put a strain on folks. We don't know how much it's going to be as far as the second wave is concerned, but in talking with a number of provider folks, a couple of watch-outs have surfaced, particularly watching out for any payment issues. Over the last 2 months, while we've been scrambling to get personal protective equipment for the healthcare delivery staff, we've had a lot of abnormal activity. Credit issues often follow a lot of that normal activity. So we don't want to get to this rogue wave of COVID-19 in the fall and find that credit issues are hindering our ability to get supplies. So just want to point that out to folks.
Well, and I think the other thing that's important to remember is this last bullet point, estimating quantities of PPE. Premier, I think, is the folks that estimated that the PPE surge, the requirements for it, have increased demand by about 17 times what's normal. And so for a typical hospital that's been impacted by COVID-19, it may be reasonable on the upper end to assume that you're going to need 17 times your normal again in the fall. And so building inventory and locking down supplies is going to be critical in that area. So just to wrap this up, it's critical, we feel, that supply chain executives need to move beyond today's scrambling for PPE, and they really have to get a handle on projections for what PPE is going to be required in the fall and the surgical requirements in between. Those are probably two key elements of this. Then work with finance to estimate the cash requirements, since cash is king and many healthcare providers are a little short on cash these days. And then locking in the reliable supplies of PPE and elective procedure supplies that you need going forward. Dennis, any final thoughts on that?
You know, John, your bullet point about collaborating with finance is really important. We would expect that a normal reaction would be to fatten up the supply chain, so to speak, and increase inventories. And collaborating with finance to let them know that inventories could grow is an important part so that you can avoid surprises.
Yep, I agree. I think that whole communication piece is absolutely vital.
Great. So, John, I just want to say that, the challenge remains to do the three things at the same time. We've got to continue responding to these immediate needs. We've got to get ahead of the recovery efforts that are coming for the summer, both operationally and financially. And lastly, we need to realign the resources for the rogue wave that's predicted for the fall. We've never had such a challenging time.
Well said, Dennis. I'd like to thank everyone who's listening today and wish everyone well along the healthcare supply chain.